About 1 in 4 people with prediabetes will develop type 2 diabetes over 3 to 5 years. We also know that not only diabetes, but also prediabetes is associated with a higher risk of cardiovascular events like heart attacks. Yet there's often this clinical inertia in the prediabetes zone, a kind of a feeling of, well, let's just keep an eye on this rather than addressing it head on. In people with type 2 diabetes, good blood sugar control now can reduce the risk of cardiovascular events years later. That's what we call the legacy effect. Part of the inertia in treating prediabetes to bring sugars into the normal non diabetes range is because the legacy effect hadn't been clearly demonstrated in prediabetes until a recent publication. So, this was in the Lancet Diabetes and Endocrinology, and it examined whether putting prediabetes into remission with lifestyle changes could reduce long term cardiovascular event risk. This was a post hoc analysis. It examined data from participants in two landmark diabetes prevention trials with lifestyle interventions. One was called the Diabetes Prevention Program Outcome Study, or DPPOS, and the other one was called the DAKING Diabetes Prevention Outcome Study. In the DPPOS study, the risk of cardiovascular death or hospitalization for heart failure was reduced by 59% over 20 years in those who were in remission from prediabetes at 1 year. In the DeKing study, the risk was reduced by 51% over 30 years in those who were in remission from prediabetes at 6 years. The pooled reduction in risk over 20 to 30 years with the two studies together was 53%, and the pooled reduction in risk of death from any cause was 37%. These data remind us that the health risks associated with normal sugar versus prediabetes versus diabetes shouldn't be dichotomized into strict categories necessarily. Rather, there's a continuum of blood sugars associated with a progressive increase in health risk, kind of like how we think about blood pressure or cholesterol levels. These data also remind us of the importance of treat early, and treat long term, remembering that prediabetes and type 2 diabetes are associated with elevated body weight and excess body fat in most cases. We need to address and treat both blood sugar and elevated weight earlier and holistically to disrupt the natural progression of these metabolic health issues, helping people lead longer, healthier lives. It's important to point out that there are medications that reduce cardiovascular risk in people with type 2 diabetes, specifically GLP-1 based medications and SGLT2 inhibitors, and in people with obesity with normal sugars or prediabetes. And here, semaglutide or Wegovy has shown benefit. And this is while simultaneously providing a host of additional health benefits. So the bottom line is that remission of prediabetes or normalization of blood sugars with lifestyle changes halves the risk of cardiovascular event or hospitalization for heart failure and reduces the risk of death from any cause by over a third 20 to 30 years later based on these data. So it's high time that prediabetes is no longer considered a wait and see scenario and rather a potent opportunity to holistically improve health and lifespan. As a disclaimer, I've been involved as a clinical trial investigator for many GLP-1 based and SGLT2 inhibitor medications, including semaglutide, and I'm a consultant for the companies that make many of these medications.